Cholera. Cholera is a bacterial disease usually spread through contaminated water. It causes severe diarrhea and dehydration. Without treatment, cholera can lead to death within a few hours, even in previously healthy people. Modern wastewater and water treatment systems have virtually eliminated cholera in industrialized countries. But cholera, even in Africa, Southeast Asia, and Haiti. The risk of a cholera epidemic is most pronounced when poverty, war, or natural disasters force people to live in cramped conditions, without adequate sanitation. Take it easy to cure. Death from severe dehydration can be prevented with a simple and cheap rehydration solution. Symptoms: most people exposed to the cholera bacterium, Vibrio cholerae, do not get sick and do not know that they are infected. However, because they offer cholera bacteria in their feces, for about 7 to 14 days they can still infect others through contaminated water. In most cases, the trait can lead to symptoms and lead to mild to moderate diarrhea, which is often difficult to distinguish from diarrhea caused by a different set of problems. Others develop more severe cholera symptoms, most of them within a few days of infection. Symptoms of cholera infection may include diarrhea. Cholera diarrhea occurs suddenly and can lead to dangerous fluid loss, up to a quart, about 1 liter per hour. Diarrhea is due to the cholera epidemic, which often has a pale, milky color that seems to be found on the water in which the rice is washed. Nausea and vomiting. Vomiting, especially in the early stages of the disease, can last for several hours. Consequences of dehydration. Dehydration can develop within 1 hour of the onset of cholera symptoms and can range from mild to severe. A loss of 10% or more of your body weight indicates severe dehydration. Signs and symptoms of cholera: dehydration, irritability, lethargy, sunken eyes, dry mouth, thirst, dry skin. Skin that slowly recovers from compression, creases, with little or no urination, low blood pressure, and an irregular heart rate. Dehydration can lead to a rapid loss of minerals in the blood, and this is necessary to maintain fluid balance in the body. This is known as a violation of normal energy metabolism. Violation of normal energy metabolism and electrolyte imbalance can cause serious symptoms, such as muscle spasms. This is the result of the loss of salts and minerals such as sodium, chloride, and potassium. This is one of the most serious complications of dehydration. This occurs when low blood volume causes a drop in blood pressure and a decrease in the amount of oxygen in the body. If left untreated, severe hypovolemia, shock can lead to death within minutes. When to see a doctor: the risk of developing cholera in developed countries is very low. Even in the areas where it exists, it is difficult. If this happens, follow the food safety guidelines. However, cholera cases occur all over the world. If you develop severe diarrhea after traveling to an area of active explosions, contact your doctor. If you have diarrhea, especially in the case of severe diarrhea, and you think you may be experiencing a cholera epidemic, you should contact treatment immediately. Severe dehydration is a medical emergency that requires immediate attention. Reasons: with the help of a bacterium called Vibrio cholerae, cholera infection is caused. The deadly effects of the disease as a result of the action of toxins from bacteria produce a number of small intestines and large intestines. The toxin causes the body to release large amounts of water, which leads to diarrhea and rapid loss of fluids and salts, electrolytes. The cholera bacterium may not cause disease in all people who have been exposed to it, but there are bacteria in the stool that can contaminate food and water. Contaminated water is the main source of water contamination. The bacteria can be found here. Surface or in water. The removal of contaminated public wells is often the source of large cholera epidemics. People who live in cramped conditions, without proper sanitation, are particularly at risk. Shellfish and crustaceans. Eating raw or undercooked seafood, especially shellfish, they come from a specific location, you will be exposed to cholera bacteria. Most recent cholera cases in the United States have been identified at sea from the Gulf of Mexico. Raw fruits and vegetables. Raw, unpeeled fruits and vegetables were a frequent source of explosions in areas where there was hell. In developing countries, uncomposted manure, fertilizers, and irrigation with water containing untreated wastewater can contaminate grain products. Grains. In areas where cholera spreads, grains such as rice and millet are caught after cooking and stored at room temperature for several hours. Cholera bacteria can grow. Risk factors: everyone is susceptible to horseradish, with the exception of the baby. This is a sign of nursing mothers who have previously contracted the trait. However, some factors can cause those who are more prone to the disease to be more likely to have serious signs and symptoms. Risk factors for cholera include poor sanitary conditions. This is most likely to develop in situations where there is a hygienic environment, including a safe water supply, that is difficult to maintain. These terms refer to refugee camps, poor countries and areas, victims of famine, war, or God's deeds. There is little or no stomach acid. Cholera bacteria cannot survive in an acidic environment, and the usual acidic gastric juice acts as a defense against infection. However, people with low stomach acid levels, such as children, the elderly, and people who are taking antacids, H2 blockers, or proton pump inhibitors, do not understand this protection, so they are at increased risk of an outbreak of cholera. This is agriculture. We are at an increased risk of diarrhea, cholera, if you live with someone who has the disease. Blood type O. For reasons that aren't entirely clear, people with a blood type are twice as likely to develop a trait as people with other blood types. Raw or undercooked shellfish. While developed countries no longer have large-scale explosions, the consumption of seafood from waters known to harbor bacteria increases the risk. Complications. It can get deadly fast. In severe cases, rapid loss of large amounts of fluids and electrolytes can lead to death within a few hours. In less extreme cases, people who don't have treatment can die of dehydration and shock within hours of developing cholera symptoms. Although shock and severe dehydration have been the most severe effects of the disease, other symptoms may occur, such as low blood sugar, hypoglycemia. During dangerously low blood sugar levels, glucose is the body's main source of energy, which can occur when people are too sick to eat it. Children are most at risk of these complications, which can lead to seizures, coma, and even death. Low blood potassium levels. People with cholera lose large amounts of minerals, such as potassium, in your stool. Very low levels of potassium can disrupt the heart and nerves, and can be life-threatening. Kidney failure. When the kidneys lose their filtering ability, excess fluids, with several of them, and waste products accumulate in the body in a potentially life-threatening state. In people with cholera, kidney failure is often accompanied by shock. Prevention. The trait is rare in the United States, and very few cases are associated with travel outside the United States or with contaminated and undercooked seafood from the waters of the Gulf Coast. If you are traveling to other regions that are known for a cholera outbreak, then the risk of contracting this disease is very low, and if you take the following precautions should be taken. Wash your hands regularly with soap and water, especially after using the toilet and before eating. Gently rub the soap with wet hands for at least 15 seconds before rinsing. If soap and water are not available, use an alcohol-based hand sanitizer. Drink only safe water, including mineral water or water that you choose yourself or disinfected. Use bottled water, even for brushing your teeth. Hot drinks are generally safe, as are canned or bottled drinks, but you need to wipe them very carefully.